Okay, hello everybody. Welcome. Tuesday night, we are live. I was supposed to have a baby, is now Talking Away the Taboo. And we are going to be speaking with Dr. Bill Petok this evening. Bill is Dr. Petok. I can't believe I'm calling him Bill. Dr. Petok is an absolutely incredible psychologist who is renowned for his work in the fertility space. And he is here tonight to give us a preview into, Father's Day is coming up. It is the topic of the moment. And all things about men and dealing with fertility challenges. And we know that men definitely deal with things differently than women do. Here he is. And it's as we deal with our partners to talk about these things so that we can make sure that we get the support that we need and that they get the support that they need. And here he is. Here is Dr. Petok. How are you?
I'm just fine, Amy. Thank you for having me.
I am absolutely thrilled. And I want you to introduce yourself to this audience. Tell people who you are, use all the accolades that you have, but give people a window into the kind of experience and the work that you've been doing in this space.
Sure, I'd be glad to. So, my name is Bill Petok. I'm a psychologist living in Baltimore, Maryland, originally from Detroit, Michigan. Came to Maryland for graduate school at the University of Maryland. Go Terps. Um, in 1985, my brother-in-law, who was a reproductive endocrinologist, Bill Schlaf, called me up while he was in his fellowship, and he said, um, I'd very much like for you to see some patients for me. I have a good understanding of how to help people get pregnant, but I do not understand the psychological issues. And I said to Bill, I'd be glad to do that because it seems to me that infertility is a family crisis, and I have a background in family therapy. You teach me the medical stuff. So we started what was a very fruitful arrangement while he was at Johns Hopkins. And then about 8 years later, he moved out to Colorado. And I've been working in the field since then. Um, he convinced me that it would be useful to join the American Society for Reproductive Medicine, where there was an active mental health professional group, which I did. Eventually became the chair of that group and have gone on to work with a lot of really bright other mental health providers from around the country. And through that, I've met an awful lot of physicians. And because I'm Jewish and have wanted to work in the Jewish fertility space for some time, I've begun to do that over the past 15 or 20 years. In fact, my first fertility case was a Jewish couple
Wow.
who were unable to conceive.
Wow.
Orthodox couple, as a matter of fact. I had nothing to do with them getting pregnant. Um, it's a great story. They tried everything, and they went to Israel and met with a mystic who said, your bed is facing the wrong direction.
Oh gosh. Right.
So they came home, and I get a call 4 months later. Thank you so much. And they wound up with 3 children, which
Amazing.
was yeah, it was
Amazing.
lovely, really lovely.
Amazing. Whatever works, right? Whatever works.
Uh, Absolutely. So anyway, that's a little of my background. Over the years, I've done a lot of writing about male fertility in particular. One of the reasons that's been of interest to me, there's two reasons. First of all, I'm a man. And secondly, in my professional group, the mental health professional group, the membership is overwhelmingly female. Approximately 95% of our members are women. And the male voice is not heard. And if you look at the statistics on infertility, approximately 50% is male and or male shared with female. So we're underrepresented, and I have taken it as an important responsibility to work with men to understand men and their issues when they're dealing with infertility, and to be a voice in that space.
Okay, so let's just dive right in because I have this burning question that I need answered. And I think that many people have this question. Yes, we know exactly as you said, the statistics are that when someone is dealing with a fertility challenge, that approximately 50% of the time it's because of something going on in the woman, and approximately 50% of the time it's something going on with the man, there is obviously crossover where there's 10 to 20% of the time where it's both of them.
Yes.
And then there's another percent. I mean, I know these percentages don't add up to 100. We're not even,
Right.
nobody's doing math here.
Nope,
So,
not tonight.
etc. And then there's other percentages which indicate that nobody knows what's going on. It's not the fault of one or the other. It's what's called unexplained.
Yes.
But here's my question. In the last 5+ years, there has been an overwhelming public discussion about fertility stuff. And specifically, it's the women who are talking about it. The
Sure.
women are talking about their emotions. The women are talking about their grief, their loss, their, lack of realizing the fact that, they wanted to be a mother their whole lives. Celebrity women
Yeah.
are talking about it.
Yeah.
Where are the men? Why aren't we hearing from the men if men have at least half, if not, a significant percentage of the problem? Why are we only hearing from the women?
I think there are multiple reasons for that. Let's start with the differences between men and women. They're very clear in many regards, and that's good. We are supposed to be different from one another. We have some similar characteristics, but in general, men approach problems in a different way than women do. In particular, the way men and women are socialized. So women learn to talk with one another much better than men do. Men learn to talk about things that are not of an emotional nature with other men. Sports, business, learning, those kinds of things, stuff that's out there. And so as a result of that, when something as critical as a fertility problem arrives, which has deep emotional impact, can have very deep emotional impact, the words may not be there, nor may the resources that are comfortable to talk with. So there's that socialization part of it. There's another issue, and I think, and you've mentioned it very well. We hear an awful lot about women who have fertility issues. We do not hear very much about men who have fertility issues. Therefore, when a man has a diagnosis of infertility, he feels like or thinks that he must be an anomaly because nobody else is talking about this. Now, in point of fact, there are several men of note who have talked about their fertility issues. Gordon Ramsay, the chef, is one. There is a country and western singer by the name of David Nail who has talked somewhat about his. And there have been others who have talked about fertility issues. Jimmy Fallon talked about it on his TV show. But it turns out it wasn't his issue, it was his wife's infertility. So that's another reason there are not people talking about this. And I think there's a third reason, and that is when men and women come into puberty, what we learn is different. So when a woman reaches the age at which she's going to menstruate, typically there is some education. It's either done in school or privately by a parent, which is about reproductive health, feminine hygiene, and things like that. There is nothing comparable that happens for men because we don't go into puberty in the same way. So there isn't that opportunity for a man to learn about reproductive health. And so what happens typically in public schools anyway is that the girls are taken out and they learn about menstruation and so on and so forth. And the guys are taken out and maybe they learn about how not to get somebody pregnant and how not to get a sexually transmitted infection, but they don't learn anything else. And so we are at a deficit when it comes to understanding reproduction, and therefore when something happens, we don't feel real smart about why it may have happened. We know much less. So I think those are the three big factors: socialization, a lack of good role models talking about it, and a lack of information that men have about reproductive health.
So, okay, so now let's play this scenario out and get very specific, right?
Sure.
A a couple comes to you and they say, "Hey, we're having trouble and we've done the testing and it seems like it's a problem on the male side." Can you walk us through? I know, like you're a psychologist. You're not a medical doctor, but from a psychological standpoint, there are a number of different pieces that potentially could be the reasons why a male is infertile, or he's having trouble with his sperm count or number, etc. Count and number is the same thing. Let's try that again.
Right,
Count or quality.
right.
And so the what are the different reactions, emotional reactions that a man has? Like, is it just okay, my guys aren't swimming, great, and so like, woe is me, and this is terrible, and like, I'm gonna be fine? Or does he talk to people? Does he not talk to people? Does it depend on how bad the diagnosis is? Because sometimes the diagnosis is, well, come back in 6 months and we might be able to find stuff, or things might get better, or there are things to do. So I'm just wondering if there's a different emotional reaction based on the diagnoses. And
Well,
then
there
and then
could
I'm going
be.
to even go, like, where I'm leading you to is also, are there different ways that we can support the men in our lives depending on what their diagnosis is?
Sure. So let's start with first things first. He receives a diagnosis, and it is you've got bad morphology, your count is low, motility is not good, or something else. And so that's just with sperm itself. It may be the delivery system which has had an impact. It could be obstructed. Um, and so there may be alternate ways to solve that problem. So the first thing is probably shock, surprise, perhaps anger, because there are 75-year-old men fathering
Right,
children. Why am I not doing
right.
this? One could talk about the wisdom of the 75-year-old man fathering a child, but that's a
Right.
different story. Um, so so you get this sort of shock, but the question really is, who can he talk to about this? Perhaps the physician, perhaps his partner, and maybe, just maybe, there might be somebody else in his social sphere who he would trust with the information. Part of the problem is men are more likely to conflate infertility diagnosis with a sexual failure on their part. And somebody was asking me this the other day. I was at a meeting, a very interesting meeting on sperm health and politics.
Okay.
Um, and it was sociologists and urologists, and they had a couple of mental health folks and ethicists. It was very
And
interesting. So somebody said, well, why?
politicians? Where are the politicians?
There were political science folks there, but the politicians weren't there. There'll be a white paper that comes out of this,
Okay.
and that'll go to the politicians. So the question was, why do men conflate an infertility diagnosis with a sexual problem?
Right.
And the answer I gave was because the act of creating a child for a man involves something which is actively sexual. You have to get an erection, you have to have an ejaculation. The act of getting pregnant for a woman is not nearly so active, or does not have to be.
Right.
It could be,
Right.
but it is not nearly so active. Now, on a cellular level, we know that eggs don't just lay there waiting for sperm to penetrate them. There
Right.
are other things going on which make them far more active, but the common knowledge is that that's what it is.
Right.
So there's this notion that I am a failure sexually now, and the language that gets used sometimes by people who are giving the diagnosis may enhance that bad feeling. So, you've got bad swimmers or you're shooting blanks is really not a good thing to say to somebody. There seems to be a problem with the motility, the way that your sperm moves. There seems to be a problem with the numbers of them. There seems to be a problem with the way they are formed. That's way better than saying something which is derogatory. We do a bad job, both with men and women, in terms of using language about fertility which is pejorative, and we're working hard to change that. We don't talk about ovarian failure anymore. We talk about diminished ovarian reserve,
Right.
which is a much kinder way of dealing with it.
Right.
So anyway, that happens, and then he feels bad. And then what do you do with feeling bad? Who do you talk to about that? Most men have, or many men have been brought up to be strong supporters, emotional rocks, and not to show weakness. And having sad, bad, any kind of negative feeling is not a good thing if you've been brought up in this sort of overly masculinized kind of
Right.
culture that
Right.
many of us live in. So we're supposed to be the supporters of our spouses, and if we are feeling bad, sad, weak, how can we be good supporters of them? So we suck it up and we don't say anything about it. Now, there are clearly other men who are far more emotionally aware and understand that showing that you are feeling bad about something doesn't mean you are weak. It does mean you're being vulnerable. I never
Right.
met a woman who didn't want her husband to be vulnerable to her. That's kind of endearing.
Right.
But so there's that going on. He could be ashamed. He could feel guilty. What is it that I did which caused this? Or why am I being punished? You know, there are lots of, and these are not unusual thoughts. Women have similar thoughts.
I was just going to say,
Yeah,
exactly. Yeah.
yeah, and but more willing to talk about them. The other thing that's going on probably is he's sitting in an OBGYN's office, a reproductive endocrinologist's office. And so that person is more likely these days to be a woman than a man. So now he's got two women sitting there, and one of them is really upset for him because she's his spouse, and the other is his wife's doctor, not even his doctor, who's giving him this information. A certain percentage of guys get the information from their urologist, who may be a woman or a man,
Right.
but it's at least it's somebody who is working, an andrologist, someone who's working with male reproduction. So you've got that going on. And then who does he tell about this who will be empathetic?
Yeah. And let me actually take it one step further and ask you, like, we've been sitting around the fertility space or the infertility space. How about also, let's just talk about loss for a little bit.
Sure,
And because that's, obviously it's a totally different experience, but the stereotypical, and again, I'm going to use that, the stereotypical male has also trouble accessing those feelings of grief, of pain, and still feeling, I think, some of the things that you were talking about in terms of feeling like they need to be the strong one, feeling like they need to be the supporter, even though they lost the baby in the same way that their spouse
sure,
did. While
sure,
it's not happening in their
sure.
body, it was still a baby that they were looking forward to. So can you just
Absolutely.
talk a little bit about the grief piece also?
Sure, there is that. Absolutely. The dream I had, maybe not well fleshed out, maybe not well talked about, of the child I was going to raise, whether it be a boy or a girl, um, now is not there. It's been dashed. And particularly when we're talking about azospermia, the lack of any sperm, which is now, it could be, we can do testicular extractions, we can do surgical procedures, but if you don't find anything,
Right.
now you're talking about using a donor. And now you're talking about no genetic connection, so your line is stopping. And, we we like to have children who come from us. Um, and what I think at that point you don't realize is the child you raise is going to be your child, whether there's a donor involved or not. And you will be the parent because you're going to do the hard work of parenting. Nevertheless, when you hear that diagnosis, there's a flood of thoughts, emotions, and it can be staggering, as it can be for a woman. There isn't any question about it. But he's got less of a vocabulary. He's got less comfort with talking about it. And if he were interested in some sort of resource as a support group or something like that, there's a huge deficit. Resolve, which is a wonderful organization, has 146 live groups now that are primarily virtual.
Right.
Three of them are for men.
Right. Right.
So, there's a lack of male providers. The number of reproductive urologists compared to the number of reproductive endocrinologists is about 5 to 1. There's a lack of male mental health providers who are specialized. There's certainly many mental health providers, but this is a pretty specialized field because you need to know about psychology as well as reproductive medicine. And so there's a lack there. And now who do you turn to? Can't go to talk to your best friend because he might say, well, what's the matter with you? Now, if he's a good friend, he certainly won't do that. But it's opening that door and exposing your vulnerability, which is hard for many men to do.
Definitely. And let me ask you this. I think the this idea that that men just don't know where to turn, and maybe because, as you're suggesting, for example, Resolve, exactly as you said, like Resolve, that is the largest fertility organization in the United States. My question is chicken and egg.
Mm-hmm.
Do they only have 3 groups for men because of the lack of resources, the lack of providers, etc.? Or is it because the men aren't seeking out support in that way, in the same way that a woman is? And I'm asking specifically because I was supposed to have a baby. I mean, okay, the ratio is not stark. We have 7 support groups, not 143 or whatever the number you said.
Right.
We have 7 monthly groups. And we have had many discussions over the years with male providers who were happy to run groups. But they told me point blank, you're not going to get the numbers to show up.
Correct.
So therefore, we're happy to have you pay us,
right.
But I think your money is better spent elsewhere.
Correct.
So I
right.
mean, speak a little to that, but also like what I'm really getting at here is if this is not where they're seeking help, then what can we do, all of us?
Okay.
I mean, most probably it's women who are listening to this, but what can we do to support the men in our lives?
Well, let's start with, you're absolutely right. Your professionals who said to you, if you got a limited amount of resources, put them where you're going to get the most from them. That's going to be with women. And it's true, men are less likely to want to go to support groups. And that's because men are less likely to seek support from a group. They might want some support from their provider. They might want some support from a friend, but they have to be willing to tell the friend about what it is that they need. So when you talk with men, I did a focus group, it's got to be 15 years ago. There's an instrument called, I'm blanking on it. It's a fertility assessment instrument for how people are feeling.
Okay.
And so we had a little focus group, and I got 4 guys to come in and talk about the questions that were involved in this document. And they were really open about it. Somebody had referred them. They knew it was going to be a safe space, and nobody was going to ask them, how do you feel? Men are, have you seen Ted Lasso,
okay.
the TV show?
Okay, I haven't. It's on my list. Not yet.
Okay. So wonderful show. And there's a team psychologist, and Ted, who's got anxiety problems, doesn't want to go to the psychologist because it's going to do something to his masculinity. The notion of therapy is what's our stereotype of therapy? It's feminized. It's you come in, you talk about how bad you feel, you cry, somebody pats you on the shoulder, you get a hug. I'm stereotyping awfully badly, but that's not what men do. Men like problem solving. Men like consultations. They like working on a team. And so the language that gets used becomes really critical. So if you're referring a guy, it wouldn't be for counseling or therapy, it would be for a consultation. It would be for some problem-solving strategies. It would be, when in Rome, do as the Romans do.
Right.
And so that's something to be learned, I think, by providers. And there are a number of us who are writing about this now. This fellow out in California, Brendan Peterson, he and I written a couple of things together. He's been working on the male issue for a long time. There's a fellow up in Wisconsin by the name of Stephen Miller, who's getting his social work degree, and this is going to be his focal area. And it tends to be people who have had personal experience or who want to make this something that's important. So there needs to be sort of a language about how to do things. We know men will access therapy services, and you don't have to, make it guys wearing lumberjack shirts and things like that to have a guy go. In fact, there was a research study that looked at that and didn't work. But a man is more likely to seek counseling if someone he knows has done so and had a positive experience and shared it with him. So, the more guys who talk about this, and there are popular press accounts of men, at least once a year, especially at Father's Day, somebody writes an article about male factor infertility in one of the major publications. And some man steps up and talks about his story.
Yeah.
What isn't happening is some really powerful celebrity isn't doing that. And that's problematic because that reaches a much wider audience.
Right.
And I think it's a function of better awareness. So it's okay to talk about how you feel. It's okay to talk about this is a loss. There isn't any question about it. You had planned on something and it's not happening.
Yeah.
That's a loss.
Yeah.
As a culture, we're not good at dealing with loss, but this is
and
this is so very, very personal. And it does involve an intimate relationship with somebody really special, and you could feel like a failure.
Okay, so give us some, do's and don'ts. Give us some pointers. Let's go with the do's first. Someone, it's your spouse, it's your partner that just got the diagnosis, or forget about male infertility, that just in general, that you're going through a fertility challenge together.
Sure.
Or you just had a loss together. Yeah. And how would you suggest the community, we as a community, how do we approach our men when we know that there is this, big elephant in the room? There are things going on. How should we do it? And how shouldn't we do it?
Well, let me start with what you shouldn't do. Oh, you'll get over this. Everything will be okay. You'll find a solution. I don't think you want to give platitudes like that. I think it's pretty reasonable to say this must be very difficult. I can't imagine how you feel. Generalizations that don't go real specific, but acknowledge the fact that this must be difficult, this could be difficult. It probably is difficult. I never say I know just how you feel, because nobody does. The other thing is, I think is, you're starting to talk about grieving a little bit with loss, and there's no one right way to do things. So there are many ways that people grieve that may be very personal. There's not a lockstep way to do it. I think if it's your spouse, that's very different than it's somebody in your community. If it's your child, that's very different than somebody in your community. If it's your child and they've told you, then how do you comfort someone? I think it's the same sort of way. That must be difficult. If there's something I can do, let me know. Typically, there isn't anything.
Right.
Or the guy doesn't have the words for it. Well, just be there is good enough. I think those are, sort of the do be supportive, do know what supports him. You know, sometimes just being alone is a good thing. I think this is true for men and for women. Um, Sometimes you want to be with people to distract you, and that's not a bad thing. That can be a good thing. Um, Sometimes you want to work because it feels better to work. Um, a good friend lost his mother, and his brother is my physician. So I saw him the other night, and I said, "How are you doing?" And he's, you know, we went through the usual thing, and then I said, "How's your brother?" And he said, "Oh, you know, he went back to work the next day." I said, "Oh, that's how he grieves." He says, "Yep, that's what he knows
Right.
how to do, and it's comfortable for him."
Right.
I would never chastise somebody for that.
Right.
Um,
And I think, but I think that that's a really important point, and I just want to emphasize that for a second, because I think many of us, and I'm going to actually just, name myself here, many of us in, these fertility situations, because their idea, or the way they're expressing their pain, and the way they're expressing their pain looks different than the way we express our pain.
yeah,
And sometimes, and I remember getting angry at my husband of like, I don't understand how you can just like leave, and like I've been in bed for days and weeks, like I don't
right,
understand how you can just like get up and go. And there was a part of me that actually knew that it was good, and knew that that the normalcy of sort of getting back to routine was very helpful for him. But I was also deeply upset by it. Like, how come you're not with me in bed, all of these days, weeks? Like, how come you're not grieving the same way? And I hear that also a lot
sure,
from the people that, come to us, and I was supposed to have a baby. This disconnect in the
yeah,
like, why aren't you doing it the way I do it?
right. And I think you're raising a really good point, which is that, first of all, each person in a couple is going to be affected differently and the same. And they're not going to go through things in the same phase. So it's not this beautiful sine wave where everybody's together. It's these conflicting sine waves where how can you be up today when I'm so down, and how can you be down when I'm so
Right.
up? Well, because we're different people. And, you know, the French say, vive la différence, right? That's not a bad thing. Because you're not in the same space that I am over the same problem doesn't mean you don't care. It means you do things differently. And I think we want to have the other person be with us in some way as a sign of, um, I don't know, an integration of the two of us, right? I mean, that's
Right.
you know, in a marriage, that's it. It's an integration of two people. But we don't feel the same about everything, and we don't experience everything the same way, but that doesn't mean we don't care. And so you get this an awful lot, where you're not in the same space as me. What's the matter with you? I think it's important to respect the way the other person grieves and deals with loss. That's critical. And you can be respectful without doing the same thing. Um, so I think the one way to think about that is just because you're not in the same space doesn't mean you don't care. It may mean you care very deeply, but you don't know how to say it.
Right. Right. And I think just actually us speaking about it now and naming it, I think will be very helpful for people, because look, even if you had two people of the same gender, it also doesn't mean that you're going to react exactly the same way.
That's right.
Everyone is an individual.
Yes, yes, absolutely. We all come to our relationships with a history of something that's different from the other person, and that informs how we react, how we behave, how we think, and how we feel. It can't not. And so some of us love apples and some of us don't, and that
Right.
doesn't mean that we're good or bad people. It just means we don't like apples or we really
Right.
love them.
Right. And how much more so, right? The person who is dealing with a diagnosis of male infertility, one person may react one way, and someone else with the same exact diagnosis may react totally differently. And like, and also we see this a lot in grief too. You know, you have someone who had, you know, a first trimester loss. You have a couple that had a first trimester loss, and one person is in bed for weeks and weeks and weeks, and the other person, you know, just as you said with your friend, and that person's mother passed away, you know, the other person is back to work the next day.
Well, and in fact, there's interesting data that suggests that when there is a reproductive loss like that, initially the emotions are pretty similar for men and for women, and then it changes somewhere at 2 years. The difference being that women are more expressive about how they feel, and men are less so. But it tends to level out. And you know, when you've had a loss, it sticks with you. It doesn't go away. What changes is the amount of time that you have between the event itself and the rest of your life. Um, my daughter, who's an oncological social worker and works with long-term um, health problems, taught me this a couple of years ago. She said, you know, a loss is like a rock, right? And there's a jar and it's real tight around it. And time makes the jar larger.
Right.
Doesn't make the loss go away.
Right.
It's still there. And I thought that was brilliant
Right.
because that is what happens. Life goes on. And particularly if you're dealing with a fertility crisis, whether it's male factor or female factor, you really want to have a baby. And so you look for solutions to that. And sometimes you get them, and sometimes you don't. And
Right.
sometimes you're able to create that family, and sometimes you are not. And you know, we hope that everyone finds a solution so that they can create a family who wants to. Um, and no matter what, there's been a loss. And that's now part of your life, just like the C I got in Latin is part of my life. Now,
Correct.
the C I got in Latin is far less impactful
Right.
because I did get a PhD.
I was going to say, unless you were a Latin professor, then we'd, you know, have a different discussion.
I would not be professing anymore. Right, right.
Okay, last question, last sort of closing thoughts. You're I'm like getting very practical. Two people, same situation, you know, one is reacting one way, one is reacting the other way. They can't seem to communicate. They can't seem to get the other person to understand about the way they're feeling. There's a lot of resentment built up on the other side. There's a lot of disappointment on the other side. Like, why can't I, you know, why can't the other one just get over it? Why can't you just, you know, really feel what I'm feeling? How do, you know, can you give us some real some practical suggestions when people are in crisis of really trying to understand the other beyond what probably is good for any couple in crisis is going to therapy, right? Or
Well,
going
it
to
could be.
another trusted advisor who
Yeah,
can
yeah.
help mediate. um how do you open up the conversation in a way that's not inflammatory? How do people start that conversation?
Well, I think there are a number of ways to do that. I think the first is and this takes a tremendous amount of restraint and self-awareness. And I will say that from the start. This is not simple. None of this is simple, right? Um, but I think you start with saying something like, I realize we're in different places. What can I do to be most supportive of you? Or how can I help you to understand how I feel? You don't want to ask why questions. You know, the why questions are, why don't you understand how I feel? Why
Right.
can't you appreciate?
Right.
There's no answer which will be satisfactory
Right.
for that. Why questions when it's about interpersonal relationships are damaging questions. Why questions are great for, there's a fact. Why is the sky blue? Because it's the reflection of light off
Yes.
of dust
Yeah.
particles. Why do you feel the way you do? We may not have a good vocabulary for explaining it. How can I better understand how you feel? How can I support you? How can I help you understand me? Those are good kinds of questions. Um, And it may be that, I say, well, I just need some space. Okay, I need some conversation. How can we arrange a time so both of those things can take place? I want to be respectful of you, and I want you to be respectful of me, because we care about each other. What brought us together here in this loss was a desire to create something special between the two of us, a child. And we're going to think differently about that, and that's okay. How can we,
Love it.
come together?
I love it. I love it. Um, uh, I'm so grateful. I'm so grateful for your time here, for your expertise, for your warmth, for your kindness. Um, this is this is going to be, it is already instructive for all the people who are here, and this is going to be put onto our podcast, and I know so many other people will be able to have a chance to listen to this and refer back to it. Dr. Petok, thank you
Well,
so much. Where can people find you? We will link out. We will make sure that we will put up your
sure.
website, but can people reach out to you also on Instagram, or where can people find you if they want to
Well,
reach out personally?
I'm on Instagram, but it tends to not be professional. I put my photographs up there. People can reach out to me through my website. People can reach out to me via email. You can put the website up. And then there are other resources I would be glad to direct people to. I think the work you're doing is critical and very important. For information about male factor, there's a wonderful podcast series from SART, the Society for Assisted Reproductive Technology, SART fertility experts. There are a number of male factor podcasts on there. One of them is, the first season was the most listened to for about 2 years because there's not a lot of good information. The doc who did it, Stan Honig, is wonderful. So that would be one place I would recommend. There's other resources, but of course your group, I was supposed to have a baby, has great resources. We don't need to duplicate anything. But they can reach me through my website. They can reach me through email. I've got a network of fun. I've been around long enough that I know people in many
I know.
places, and we'll be glad.
I know that's why I think it's critical when people are interested that they should reach out to you, because you know people everywhere at this point. So yeah.
Well, I've been very fortunate. I've been blessed, and I'm very appreciative of this as a platform, because it allows me to talk about something which I think is very important. And obviously, you I was supposed to have a baby, recognize the importance of it as well, and I appreciate that.
Absolutely.
Yeah.
Absolutely. We will definitely link out all of those things. We will share your email and your website. Dr. Petok, thank you so, so much.
Thank you very much. I really appreciate the opportunity to speak with you and with the Instagram crowd out there.
All right. Good night, everybody. Good night.
Good night.